Annie, I thought we'd talk about some typical questions that really come out when people come to treatment at Choices.
Okay.
So the first one that we typically get asked is, how long is this going to take?
Well, I would say it's going to be a variable length of stay for how long someone's going to be in the program. We ask that they commit to at least 2 weeks of the program so they get a solid foundation in their treatment. And then after that, we'll work with you. We'll collaborate with the patient to talk about what fits their needs best and go from there. So it's going to be on a case-by-case basis.
Okay.
Do you think people will be in the treatment forever? Because that's often a question people ask. Will I be here forever?
Yeah, absolutely. And that's not the case. I mean, really with treatment, what we see is people come for the first initial 2 weeks. And the great thing is about Choices is that you get to pick the groups that really work for you, whether it's more the educational groups or the psychotherapy groups.
Okay, great.
So you get to choose, and we see that usually people are there for maybe the first 2 weeks and maybe a couple weeks after that.
Okay.
But just depending on how many groups that they take.
Sounds great. What about medication? Do they need to be on medication when they come into the program, or are they on medication on the program?
Medication is one, we have people that are on medication and sometimes people that don't need medication. I mean, that is something that is definitely a case-by-case basis. We're not one of those programs that says no medication, and we're not a program that says you have to take medication. We're just one of those programs that will work with you to find out what's best for you.
So they may or not be seeing a psychiatrist when they're doing the program.
Yeah, may or may not be seeing the psychiatrist.
Okay, great. What other questions do you think people usually ask when they start a program?
Okay, I think when people start, there's, do I need an outside therapist?
Okay.
Like, do I need an outside therapist while I'm in this program, or maybe towards the end? What have you seen that's really effective for people?
Usually, if they're doing a program 4 days a week, they may not necessarily need their outside therapist because they're getting a lot of therapy every day. So they might get therapy burnout, so to speak. So again, it would be on a case-by-case basis. So an individual may want to continue with their therapist or take a break while they're in the program. And then we'll certainly refer them back to their therapist when they're done with the program, because we want to make sure that they have that continuity of care. And we'll also work with their therapist as well, letting them know what's going on with their patient so that when they do see them, whether it's during the program or after they're done, they know what's been going on and what they need to continue following up on.
Yeah, and I think that's a very important aspect to really point out, is that we will work with the therapist. We do, like the therapists that refer to us, we will work with them and refer back to them when the patient is finished.
Absolutely.
Okay.
Okay. What about discharge planning?
Discharge planning, I think, is something that's very, very important to us, because after all, like, you're going to be taking the skills that you learn outside of here, and we want to make sure that those people are successful. So if you don't have an individual therapist, like, we're definitely going to try to work with you to find one, or if you do already have a therapist, of course, like we said before, we're definitely going to work with that therapist to find out what's going to be the best transition for you.
Okay, great. I think that's most of the questions I think people normally ask when they start a program.
I think so.
Yeah. Okay.
All right.
Well, thanks, Brandon.
No problem. Thank you, Annie.